There is no health without mental health. We don't feel well, we don't operate well physically if we're not doing well mentally. The behavioral health landscape is really complicated, and it's hard to navigate and to even know what services you need. Of the 1 in 4 people who have a psychiatric disorder in this country, 39% didn't see a provider, got no services in the past year. And that percent goes up to close to 90% when it's a substance use disorder. There are so many people who have conditions and we have treatments for them, but they're not accessing those resources.
There is someone they can call that will help them find what they need, help navigate, steer them in the right direction. And that's Behavioral Health Connection.
Behavioral Health Connection is our social services and community resource program, and we help people find what they need for mental health care, social services. It's mainly focused on behavioral health and substance use disorder services.
They may be struggling with food insecurity or housing issues, maybe difficulty figuring out Medicaid and Medicare and how to apply for those services.
The Behavioral Health Connect program helps people at all stages. Sometimes people don't realize the barriers that people have. Sometimes people don't have internet access. Sometimes people don't have the gumption, frankly, because they've been demoralized by difficulty accessing treatment, and they just need a warm, caring person on the other end of the phone to help them take that next step and empower them to continue to seek care when there's so many barriers to effectively accessing mental health care.
It's incredibly vital that we have these community resource programs open to people. The most important thing is establishing that relationship with people, understanding what their struggle is, what their need is in that moment.
This is for the whole community, so we all understand how difficult it is to be dealing with that, whether it's for the person themselves or their family member or someone that they're a caregiver for.
We are all very dedicated to our callers, to our patients, whoever we're talking with or working with.
It's exactly why I do the job, because I want to be the one that finds them what they're looking for and what they need.
What BHC gives people is hope, that there's something out there to kind of uplift their spirits and to help them make it to the next day.
So we've been operating for 4.5 years, and we've fielded 11,000 requests for help. Some people call more than once, so we've had over 7,000 unique individuals ask for help.
I used to feel afraid and scared, and I used to just want to run away or hide, but they give me the strength to come out and talk. This place makes me feel like family, home.
Without them, I would probably be lost. I adopted 6 kids. All of them had some kind of substance in their system. Behavioral Health Connection has done wonders for my family. Getting them on the right medicine and getting them connected with the right resources in the community has really helped me.
I couldn't be a psychiatrist without the behavioral health program. I need somebody who's attuned to those needs and has the ability to help connect people to other resources outside of my office. It meets the needs of people wherever they're at. When I tell somebody, hey, I'm going to refer you to the Behavioral Health Connect program, I feel 100% confident that they're going to be met with caring, compassionate person who's going to listen to their concerns, understand them as an individual, and work with them to come up with a plan that's going to improve their life. Help is available, and it's really only a phone call away.
We understand how overwhelming it is when you have a mental health condition, how hard it is to figure out what do I need and where do I find it, and we are here to help.
We're the great connectors, connecting people to resources in the community.